Hi guys, welcome back to Codemaster Coach, your medical coding tutor. Guys, today I'm trying to answer the questions that are coming in, especially in the past week when we were converting ICD-9 to ICD-10. I've got a couple of comments about which classification system to use and when. How do you know when to use ICD-10-CM, CPT, ICD-10-PCS, etc.? And it all depends on the setting of which you code. Just remember, for outpatient services, we generate an ICD-10-CM diagnosis code and a CPT procedure code. But for an inpatient, when you're saying inpatient, I'm saying hospital. You're going in, you're laying in a hospital bed. Then if you're a hospital coder, you're considered a facility coder. Therefore, your coding is generated to bring in revenue for the facility for which you code. So for the diagnoses in a hospital, you'll generate an ICD-10-CM diagnosis code, but for the procedure, you'll generate an ICD-10-PCS for the facility to get reimbursed. Now, as the physician's coder in his office, when that physician sees a patient in the hospital, I will be generating the CPT codes for hospital, like surgeries, hospital visits, hospital consultations, etc. I'm his physician or his office coder, so therefore I'm responsible for generating claims or codes for services that my physician renders. And in the settings, because I'm not a particular setting coding facility coder, I'm my physician's coder, then I will be generating still the ICD-10-CM diagnosis code and the CPT procedure codes for what my physician does in whatever setting he or she goes in. Also, think about it, emergency room. If you're an emergency room coder, are you coding? There's still two sides. Are you coding for the facility or are you coding for the physician? If you're coding for the physician, you're still generating the ICD-10-CM and the CPT. And for the facility, as far as the emergency room, you're going to generate your ICD-10-CM code. And remember, emergency room is still considered outpatient, so you'll generate a CPT code for the procedure. So think about, again, it all boils down to whatever setting you're coding for. Same-day surgery. You go in, have the procedure, and go home. So there's an ICD-10-CM diagnosis code and a CPT procedure code for your physician that's performing whatever surgery, same-day surgery that you're having done. You're generating that CPT code for that service. Observation, you're still not admitted to the hospital. And I know it seems like you are, because you're actually in a lot of facilities laying in the same hospital bed you would lay in if you were admitted to the hospital. But under observation status, you're still considered outpatient. All right, guys. So I hope I'm making sense of the different classifications and what services you would render depending on your job. If you're a facility coder, you're coding for that facility. And if you're a physician coder, you're coding for that physician. All right, guys, this whole month of August, I am going to be reminding you that Codemaster Coach will be starting her next cohort of students on September 13th. So if you're interested in learning medical coding, be sure and email me at codemastercoach@gmail.com, and I will gladly answer any questions that you may have. Remember, the first class, which is medical terminology, is an independent self-paced course, and you need to get in that course now to be ready for the September 13th start date for medical coding level 1. Again, email me at codemastercoach@gmail, and I will gladly send you any additional information that you need. And any questions, feel free to type them down below, and I'll jump in and answer your questions as far as these videos. All right, guys, thanks. I'll see you tomorrow.